to work then. Right. So welcome to this event, and hopefully our chair will join us in a short while. We've been talking about mental health for a long time on the Health and Safety Committee, and we were looking at how we could progress the issue. We've had a number of meetings to see if we could get reps involved in doing things on mental health, and so we thought, well, let's have an event now we can do on Zoom to sort of look at all the different issues around mental health and mental ill health, and then we'll see how we can take those issues forward. So really, we want some input from yourselves, but even if it's not today, then we want some input after today. You can email us and we'll look at how we can take up some of these issues. So the title of today was about mental health at work. And we've got a number of speakers, some brilliant speakers for you today. We've got Rob Miguel's going to speak in a minute about taking the stress out of work. We've got a young member, Matthew Trafford, who's joined us. And he's going to talk about young workers' mental health. We've got Phil Taylor from Strathclyde University going to join us, and he's going to talk about some of the work that he's been doing with the call centres and home workers. And he's going to share some findings with us. We've got Janet Farrar who'll join us in a short while. I think she's chairing a congress session at the moment in UCU. So she's going to come in and talk to us about support that we need for reps. And then we've got Sarah Walters from Leeds University speaking about some work that she did on workplace and suicide, which I think you'll find interesting, and certainly give us food for thought about things that we could do. And then finally, we've got Jim Mowat joining us, who's the Director of Education, and he's going to talk about Unite Education, what's available, etc. So our first speaker needs no introduction for us because he's joined us a few times and we'll know him in the union. He's National Health and Safety Officer. I'm not sure that's your proper title, Rob, but it's something like that. But somebody really important in health and safety is what I'd say. Does some fantastic work on behalf of Unite. And I'm really pleased that he's able to join us. And I'm going to share a presentation. Is that right, Rob? Over to you anyway.
Yeah. Yeah, shall I kick off?
Yeah, you kick off.
Yeah.
That'd be great.
The first point up in a minute. And just to say, Janet, regards the level of importance, the reps are the most important people in the union, and I've got the greatest respect for reps. Being a rep myself. Janet, sorry.
Sorry, have I confused you?
Yeah, you cut me off, but I'm back again now. So I'm just saying, I think it's the reps are the important people, and it's about ensuring the reps can actually work properly in the workplace. That comes from me supporting them, the officer supporting them, and education. So we go straight into this. Only got 20 minutes. So if you have a look at the figures, those are the figures for 2018-19. The HSE produced figures from behind, and you can see the figures are quite alarming, aren't they? As they always are for health issues. 602,000 workers suffering from work-related stress, depression or anxiety, 12.8 million working days lost due to related stress. This report is a lot more complicated than this, but I thought I'd just put up the facts here. And it goes through the issues supposedly causing stress in the workplace: workload, lack of support, bullying and threats, changes to work, etc. The cost, it depends where you look at when you're looking at the cost. So I've looked at a couple. If you go to the Centre for Mental Health, they put the cost just to businesses about 34.4 billion. If you look at Mental Health Foundation, they're looking at an ONS report, which puts that at around 25 billion, which is the cost of GDP. 5.6 billion is the cost of people actually leaving work or going on to part-time in order to care for someone. So even just that is a massive cost to it. So, do you want to just move on to the next slide, Janet, if you would? Brilliant. So, what we're looking at here is COVID-19 mental health and well-being surveillance report, and that was produced by or commissioned by Public Health England. And again, it's just a little brief look at it. You can see there, this is about COVID-19. So if the figures weren't bad enough that we looked at just now from last year, they're getting even worse now with the with COVID-19 coming into the play. So research covers up to week 30. Okay, so in week 30 this year. And what was pointed out was the decline or the increase in mental health issues was highest in April. So mental health distress was 8.1% higher in April 2020 than between 17 and 19. April 2020, over 30% of adults reported mental distress indicative treatment. So that's the people that needed treatment. So 30% of all adults, I mean, that's amazing. And that's compared to 20% between 2017-19. And, you know, the causes of that are well known now. When we first went into this, you've got restrictions on personal freedom, job losses, and we know that there's more to come. The cost of human suffering is immeasurable, but the Bank of England have tried to calculate what would have happened if we didn't have a lockdown. And the figures, you can get that report online, run into billions. So they amazingly try to calculate what a life is worth. And I think they estimate they run about 30,000 a year. And we would have, if we didn't have lockdown, the estimate would have been something like 200,000 deaths. Which would have cost about 30 billion. So it's a bit, I don't like putting costs on a person's life. It is immeasurable. But as well, what we've found as well, there's cancellation to cancer treatments. Children are being deprived of schooling. And because of the lockdown, there's more domestic abuse. And generally, not only causes stress, it's physical violence, but people caught in domestic abuse situations now have their whole family, including the person that's abusing them, home on a permanent basis when we're in lockdown. How do they get help, and how do they phone someone in that sort of situation to have all of this stuff going on? And in relation to, so we're looking at two things here. We're looking at, or three things. What's happening in work? How can we do something in work? What's happening at home and in your private lives? And also the cost and the increase in mental health due to COVID-19. So in general, the HSE, and this is amazing, I don't know, Hilda's usually great on facts and she wouldn't be able to pull it out. The stress management standards, I believe, have been in, I remember, a good 20 years now. Employers have done very little in relation to what's in the stress management standards. And that looks at things like demands, control, support. So demands on a person, you know, from work, from his home life, how much control do they have? In a lot of them, you know, in the gig economy, low paid jobs, there's not much control. What support do they have from their line managers, from peers, relationships? So the relationship positive in the workplace, and understanding their role is an important thing. And generally, if you've got a workplace where there's good consultation, there, and particularly where it's unionised, where it's non-unionised, it's a different matter, but there's a lot of consultation and there's a bit of satisfaction there in knowing that you're being included in the discussion for change. Things have got a bit haywire since COVID-19, as you can see. There's threats from large conglomerates dismissing people and then trying to re-employ them on less terms and conditions. This here, I hope you can see that. It looks backwards to me, but you might be looking at it forwards. That's the talking toolkit. This one has been, it's been designed by the HSE, and that's actually based on the stress management standards. What it goes through is demands, and it's about having conversations with employees. So a good kit. So this has been around for 20 years, as I said. I've seen an increase in mental health policy since the advent of COVID-19, and mental health has become into the forefront, and even so now with COVID-19. So it looks employers seem to be moving. Can we go to the next one, Janet? Okay. So what does the union do? And I mentioned about reps being the most important people. What do we do? So at the moment, I've been heavily involved in this stuff here because I wrote quite a lot of this about providing guidance to reps and to officers. And you can see there's a whole suite of stuff there, starting with guidance for officers and reps. And that is, if you have a look at this, when we finished, it's actually a one-stop document which leads to other documents, government guidance, Unite guidance. It's a good document to actually go through if you want to try and find some information, because the information now is massive. Even myself, when I'm trying to research this stuff, I'm going around in circles. It goes from one document to another and it opens another one. So it's very different. So it's nice to have for a rep, for officers, have some guidance there. Risk assessment, and you can go through all these down to BAM. And at the bottom, because we're talking about mental health, and that's the shortest document, because what I find is, and as I said, I haven't been a rep myself, is I don't want to open a document, it's like 50 pages of stuff. I want to get to the nitty gritty, and that's about 4 pages. And it it tries to provide help for reps in terms of what their workforce will be going through, about feeling anxious, about being stressed, about the things I'm talking about, the fact that we can't access medicine properly anymore. It's difficult to get to the doctors. All of these things, and about being stuck at home, working from home, and those that have to go to work. Because apparently the virus doesn't operate the same in the workplace as it does, in the community. So, you can say all of these things apply in the community, but you've still got to go to work. And it's about trying to ensure in the workplace that, I don't like this term, COVID-free or COVID secure. Is about trying to reduce the risk for workers. I'll talk about finances at the end, but the government at the moment, I suppose we all are trying to balance our finances with the risk of actually going into the workplace and being exposed to this virus. Without me going into it, that the virus affects older people more severely. It affects BMA, it affects pregnant women. So therefore, if you're young in your young group, you're not going to have such a severe reaction to the virus. However, if you go into the workplace, then you're taking it back home to those groups anyway. Right. So this mental health guide, fairly good. It goes through a whole lot of things, and it also signposts you to where you want to go. Dana, can you just move on? Okay, so this is quite interesting. Okay, this here. So this is now we about companies. This is a pretty good one. This is in the nuclear industry. It's a dockyard which repairs and refurbishes the fleet, okay, including nuclear submarines. Very good company. I personally had discussions with them over this, and what you're looking at there is a triage system, okay? So it's about an employer working with their reps, because that's what happened here, in order to put up a system which would work for their employees. So if you go down there, I've sort of uncomplicated this, you can see there's various levels of this. So how this works is that an employee has various options if they're suffering from mental health issues. Okay? And those options would be to go to a helpline and have a conversation with somebody, go through the employee assistance program managers, and they will refer them to either occupational health or HR. And you can see they can also go online. The difference about this is there's not much point in actually referring someone for mental health issues just particularly for mental health. So the triage system is about trying to find out whether there's any causative factors to those particular issues and direct them and signpost them to them. So you can see, if you look right at the bottom there, you can see there's a couple of titles there. So structured counselling, specialist counselling, debt counselling, family care, online resources, and so on. So structured counselling, there's so that's about having specialist interventions, inclusive structured counselling. So that's being able to book with a counsellor through this system to have about 9 or 10 free sessions. Okay, so and if you go further down, confidential care. So what you've got there, so one of the contributing factors could be debt, for example. Okay, so debt and financial support. So when you split this system down, they offer advice for unsecured debt. So they've procured a company to actually do this, different companies. They even offer a service where they have negotiation with creditors, bankruptcy, repossessions, income tax issues, financial makeover. So you get the picture. So it's like, yes, I'm suffering a mental health issue, but I've got all these problems as well. So that's one. Legal and tax support, estate planning, consumer law, family law, etc. So you get the picture. So everyday matters, which is the third one down. Time management, moving house, simply finding a doctor, social events, parenting, family support, parenting, divorce, education, and so on. All right, Janet, I don't know what's happened with your slides, but you've thrown them forward.
Sorry, I'm just trying to find the.
Okay. Well, I'll keep talking while you're doing that. Yeah. So you get the picture with that without going into too much detail, because there's a lot of detail. It's not just about trying to find out if someone has mental health problems. It's trying to find out whether there's contributing factors, and that could be abuse as well. Okay, so this is a company that's put together this system, employee wellbeing, together with the reps, together with the managers as well. So it's a very good tripartite system. So absolutely, I wanted to highlight that, and we've got the same sort of programs going on in larger industries, such as the rail industry, Network Rail. We're discussing with them a sort of similar type of program. Okay, so we share that. So you get the picture. That's a good example then of a company that's actually trying to do something and support their people. All right, not just do a risk assessment. Right, Janet, don't worry. It happens. Okay, if you when you went through the last slide, you'll notice that two things came up there. One was rail wellbeing live. Now I just talked about rail on purpose. So there's a massive initiative in the rail sector on well-being and mental health. So on the 4th and 5th of November, there's a conference, and I took great pains to actually to look at this, because we were involved. There's a committee called Wellbeing Tripartite Committee, whatever it's called, where we discussed this conference, and we also discussed whether that facility, rather than just having a seminar, should occur regularly. So every Wednesday, all the reps, all the employees can actually go in at a certain time and have a discussion. This conference is going to be attended by the likes of, let's have a look, Dame Carol Black, Ruby Wax, so on and so forth. And what I wanted to happen was, because as you know, I've sent this out to rail reps, so this is for the rail industry. But as you know, if you're in work, you ain't going to be attending a conference for 2 days, are you? Okay, so what I said was you should have sessions, about 12 sessions a day where people can drop in and out. All right, so on this particular event, you can drop in and out of that. So again, it's an initiative that's part of a wider initiative within a sector, if you see. So I'm giving you a company example, now a sector example of where people are all working together, reps, officers, and managers, the Office of Rail Regulation, which is regulating rail, all working together constantly to get up programs, initiatives, and make things better for their employees. Okay, so the picture in a lot of workplaces, and I haven't sort of talked about the ones that are rubbish, and we know there are a load of rubbish ones out there. In fact, remember I mentioned the gig economy. I don't know if you've seen the film with a young lad that his father, his stepdad bought him a motorbike. Black guy, about 20 in London, and he got a job in the gig economy delivering blood. Well, really important role, you know what I mean? So he had to get his own bike. He had to buy a slot. He didn't know what he was doing, basically. So you go through London. I would never drive through London. He was going across and going into bus lanes. He'd get a fine. He didn't know what was happening because he was very experienced. He had all this money to pay out. The fine would come. He'd ignore it, and then what would happen later is the fine would go up, as you know. Okay. Now this young lad eventually committed suicide because he got all too much. So we can see that the quality of work is also important. That where you've got trade unions and it's well organised, things don't always go perfect, but they go a lot better. Okay. So which brings you on to this last slide, Janet, and I'll try and rush up a little bit. I don't know into time yet. So the reason I put this up is to look at what those little dots are showing you is how countries are actually doing in terms of deaths. So what measures they're taking, but it also looks at where they are in terms of GTBR. So you can see that. So if you look on the left-hand side, what that's saying there is, if you look at South Korea, it says -5, China 0. This is the fall of GDP, okay? Gross domestic product. And on the bottom, these are the deaths per, so many per million, okay? Cumulative deaths per million. You can see, I can't see it because Janet's face is hiding it. If you have a look at over onto the right-hand side is the UK. Hopefully you can see that. I don't know, because you might have the box set. You might have that box on the right-hand side. If you minus it, you'll see the UK. Oh, I can see the UK down the bottom. You can see we're one of the worst. So actually, our death rates are high, and also our gross domestic product is sort of -23, something like that. And if you look up to the left, you can see countries like Vietnam and China are both doing well in terms of deaths and also in terms of gross domestic product. And you've got Germany is, you know, in mid-range -10. What that's telling you is that that's where countries are getting everything wrong. And we seem to be right there on the right-hand side, that little dot there, you can see it. So this is connected to mental health in the sense that we're getting it wrong. And therefore, people are going to be worried about their futures, their jobs, about whether they catch COVID, are they going to die, because we don't seem to be having a great record. So it's an interesting fact there to have a look at that. So look, Janet, I'd love to talk all afternoon to these people, but obviously there's other speakers, and hopefully I've said enough. Yeah.
Thank you so much, Rob. That was excellent. You know, there's some of the things that you've talked about in terms of the stress management standards. I know that, you know, that list of stress management standards, that if you get people to talk about those, you know, whether they've got demands or whether they've got controls in work and the support that they need, really gets members, you know, looking at the whole issue of their job and how they're supported in their work. And it was really good for you to put it into the, you know, to the context of the pandemic now. So apologies for me going on too long. I couldn't find the controls to take us back, so apologies for that. But thanks very much. And I'm sure if there's any questions that we can then collate them and then send them on to you, Rob. So thanks. I know you've got to go early.
You haven't got the time, have you?
Yeah. So, but I'll just take Matthew now. And then we'll come back and see if there's any questions. If people want to think about a question for you in the next few minutes, then please do. So our next speaker is Matthew Trafford, who's a Young Unite member from Chorley in South Ribble, and he's a young counsellor as well. So he's going to talk about young members and mental health. I'll just ask you to unmute.
Hi, thanks, Janet. Am I audible? People can hear me okay and everything? Yeah. Excellent. So I'm Matthew Trafford, and I'm I was proud last year. I was elected as South Ribble's youngest ever councillor when I was 19. I'm 20 now, and I work as a support worker, and I'm in Unite Lancashire Community Branch as well. So thank you for inviting me today. I'll start with what some would call a sort of trigger warning, and if there are elements of this that people might think is sensitive in relation to young people's mental health issues concerning that, then I totally understand if people want to have a brew or whatever during this. So what I want to sort of talk about really is the societal factors which inevitably affect the workplace, and then how the workplace can respond to this. Now, I think the first thing to do in relation to young people's mental health is for me to explain the severity of the situation that we're in. For the avoidance of any doubt, just so there's some idea, only 2 weeks ago I received the news that a lad that I went to school with and was in various classes with, his name was Hayden Lishman, this was on various news, and committed suicide 2 weeks ago. He was 20 years old. I think that there is a cultural responsibility as well when we discuss this. So I'm happy to say I'm someone who has their own mental health issues. I'm sure I'm not the only person in this meeting who does that. And I think that we should be wary of that when discussing this. So within my time as a counsellor, I thought that most things I'd be contacted about were parking and dog poo. I was very wrong. It's been overwhelmingly about mental health issues. Most cases being parents who are terrified for the well-being of their own children. So there's some examples from my own casework here that I'd like to go through. A young girl in Leyland who had been brought up with an abusive stepdad, a mum with serious mental health issues, and as a result, she suffered from PTSD and severe anxiety. As a result, she was absolutely terrified of going into school. She wouldn't go there. Her attendance was very low. And the solution to this issue wasn't let's provide more mental health support, let's see if we can create an environment that's safe for her. Instead, this working class family that were already struggling financially were being threatened with fines for the fact that she wasn't attending school. Another resident who I represent, a guy, again, with a history of abuse in his family, PTSD, severe anxiety with alcohol and drug abuse issues. The only house that he's been able to be provided with is one that's within about 10 yards of an off licence. Now, I'm sure for anyone with who understands alcohol and drug abuse, that's probably the worst possible place it could be put. Whilst he was there, he received issues of harassment from a group of young lads whilst he was there. When he phoned the police, rather than dealing with the issue, considering his well-being, they put him in the back of a police van, took him round to a relative's house, where he sort of received sort of further abuse from them. Another young girl, which again is a history of abuse in her family, who was having issues at school, not attending, also in relation to not completing work and so on. And the school decided to exclude her from school. And this is a girl with severe mental health issues. And when I went through in a governor's meeting and listed the things that needed to be done to address these mental health issues, done 1 of 10 things before making the decision to exclude. Last week, I was phoned by a woman in my ward who was crying her eyes out because she has 80p in a bank account, no food whatsoever, and a universal credit isn't going to come through for another 3 weeks, and she has 2 young children. And then, just in case sort of the demand, that doesn't show the demand enough, in Blackpool, there's a school where year 11 students are selling what are known as self-harm kits, which is a Tupperware box with bandages and razor blades, because the demand for children wanting to harm themselves is so great that people are actually doing that. So I think that should give some idea of the severity of this situation in places not far from ourselves. So as I say, this is sort of a cultural issue. I think that there's massive misunderstanding with these issues. I think that the biggest misconception is that people often think that young people are depressed because they're sad, when actually they're sad because they're depressed. This is chemical imbalance in the brain. This should be treated like any other health issue, and just sometimes suggestions which may well help and may well alleviate certain problems, but they won't eradicate the problem of mental health problems itself. We then see campaigns that ITV does a big one about, let's get Britain talking. We need to talk to one another, which is well and good, and that has a place, but talking to your friends and family only goes so far. They're not professionals, unless maybe in the occasional example they are, but generally speaking, they're not. And that shouldn't be a replacement for professional support. And I think politically, this issue is widely neglected. So when we discuss healthcare and health inequalities, very often we hear about A&E waiting lists. And we hear the tales of people in corridors waiting to be seen to, and as a result, well, in many cases, dying, or the health being ended up in a worse place than it was when they came in. That is obviously horrendous, and rightly so, and we're right to challenge that. But the hours waiting list, sometimes over that, days sometimes in A&E, whilst that is obviously horrendous, that is nowhere near as long as the waiting list for people waiting to see CAMHS, where the waiting list can sometimes be up to 9 months. So then what happens is we have the health inequality that comes with that, where people from poorer families, and very often, in my experience from when I've been sort of dealing with my residents, it's those from working class families who might have problems with income, housing, and so on, that are going to have aggravated mental health problems. They're on these 9-month waiting lists. Meanwhile, the people from maybe more affluent and middle class families, they can afford to pay to see a psychotherapist or a therapist privately. And then what we have is we have people on waiting lists and kids who were sort of harming themselves to a massive extent for no other reason than the fact that they were born in a poorer family. Had they been born in a more affluent area, they would have been seen to easily because they could afford to do so. And then the heartbreaking thing that comes with this is when I went to South Ribble Youth Council, and I went to talk to them about what they thought about mental health support, how they felt about it. I was told by a 12-year-old girl that she took an overdose of paracetamol to prove that she was depressed enough to receive support. Now, that begs the question, in what world are we willing to take that risk? Are we willing to have to leave 12-year-old children to have to prove that they're depressed enough to receive support? So we have numerous aggravating factors. I mentioned housing before in relation to one of the issues of casework that I've dealt with. And I think if people have insecurity about housing, if people don't know where they might be living next, or even if the living conditions that they're in simply don't meet the human needs, if the place that they live in is falling to pieces, which is often the case under private landlords and housing associations, then that's not going to help. I mentioned universal credit as well, and I don't think I need to speak for long on that issue. I think that within this, we're all going to have a pretty good understanding of how that's done nothing but batter most vulnerable people's mental well-being. So then what's the government doing? What is their approach? Because surely they can't say this isn't an issue. So what they did when I went to a Westminster Policy Forum meeting, it's all about early intervention. That's what they argue. We need early intervention. I'd disagree with that. I don't think it works. I think we don't need early intervention. I just think we need consistent support throughout. But nonetheless, let's say that early intervention is the way forward. That can't actually work, because by the time people actually have access to support, this isn't early intervention. This is intervention that is far too late. And as a result, so people wanting to deal with the mental health issues, wanting to get support, are constantly chasing the problem. They're always a few steps behind because they've been waiting for too long and can't get to the proper support that they need. We then have the C word, coronavirus. what does that do with young people's mental health problems? Well, first of all, what an insult that the government has somehow decided to blame young people for the second wave, despite the fact that we could have seen this from the offset because of their own shambolic handling of this issue. And if you're one of the young people who, like myself, work as a support worker, or maybe you work in a hospital, maybe you work in a school, maybe even in the hospitality sector, like many of our young Unite members are, and then you're being told that this is actually your fault, and despite the fact that you're putting yourself in danger to earn a living, and because we've been told that we need to, economy comes before health, and then this culture of blame surely doesn't help anyone's mental health issues, especially if you feel that the work that you're doing in the workplace isn't being appreciated and is actually being attacked. We then have the universities as well. I'm currently in my absolutely delightful university dorm whilst I'm here. And I think the worry in university that when you leave, you're going to leave with 40 grand debt is one thing. But now we're not just leaving with 40 grand debt, we're in essence leaving with 40 grand debt for what was in essence a course of PowerPoints. We're not actually receiving any proper lectures. We're not actually receiving the product that we thought we were getting ourselves in for. And then as well, the living conditions that come with universities, if you have a housing association or a private landlord, we're being told, well, because of coronavirus, dealing with issues in your household is going to take longer, despite the fact that universities are probably one of the only industries that aren't financially affected by coronavirus, because they're receiving the same amount of rent and the same amount of tuition fees, despite all of the changes. And there's not many industries that can say the same. So with all these issues existing from a young age, I think it's fair to say that with these not being addressed when they should be addressed, that in later life, this is only going to make things harder. And that when entering a place of work, there's going to be a lot of pre-existing issues that haven't been addressed, that when in work, when things like we discussed workplace stress just then, and issues that occur in the workplace, the mental torment that will be caused by that will only be worse because of all the pre-existing neglect that's happened. So what can we do? What is it that needs to be done? Well, the first thing for young people is we have to get them joining trade unions. In my experience, when I'm in university, when I'm speaking to young people, and I wish it was different, I really do. When I talk about trade unions, I'm normally asked, what is a trade union? And then that's normally followed up with, what do they do? I want to have a culture where I don't have to explain that really, and it's pretty much understood what we do. And it's pretty much understood that it's an essential part to protect your well-being in the workplace, being part of a trade union. We then need to campaign, and I think that the community branches have a vital role in doing this, and they've done it quite well in Lancashire, is to make sure that mental health support is accessible and at the free point of use, like we argue for all health services. But for some reason, mental health seems to be neglected when we talk about that. We focus on physical health rather than mental in this way. We then need to make sure that when we have union reps and when we have stewards in the workplace, that they're doing everything they can to make sure that management structures and the employers are doing everything they can to make sure that people's mental well-being is protected at workplace. I know from my own experience as a support worker, I've dealt with some enormously traumatic issues within my work, and you don't have to look very long to learn about vicarious trauma, where there's been virtually no mental health support after dealing with such issues. And then I think that we just have to make sure that all aspects of the trade union movement and the labour movement are incorporating the injustices in relation to mental health. So what's been done so far, where there's sort of an element of hope, so I've talked about my role as a councillor within this, is at South Ribble Borough Council. My job is, as our youth champion, is to sort of liaise with the cabinet and make sure that we're addressing mental health policies. And we now have a young people's mental health agenda, which ties together all of the different organisations that aim to address mental health in the borough. And we aim to fill the gaps. So where there are people falling through the net, like there's so many are. I think we use the phrase falling through the net, but I'm going to stop using that phrase, because that would imply that it's sort of a one-off, and that's sort of like But I think most people are falling through the net. I think that falling through the net has become the rule rather than the exception with this issue. But what we aim to do is to fill these enormous gaps and make sure that people have access to mental health support, whether that's helping with prioritising young people or also providing the funds for young people to see people themselves. I'm happy to now go into a discussion. I welcome any, maybe not even questions, but just comments, whatever. I'll go back to you, Janet, now. Thank you for listening to me. I don't often get invited to do things like this, so thank you for that. And I'm sorry it's all quite serious and all very bleak, but that's the reality where we're at. So thank you, Janet, for inviting me, and thank you for listening, everyone.
Thank you so much, Matthew, for joining us. You know, you've painted a really horrific picture and graphic picture about what's happening in the reality of the world, like, you know, at the moment. And I think, you know, some of the work that we did in through the UF project with Damien, you know, looking at how it impacts on young people going into work and some of the issues and support that's necessary to put in place to, you know, to support young people as they come in with all this baggage, I suppose you could call it, like, you know, but all these issues that they've had. Is there any burning questions you want to, just anybody just wants to ask? I know we're running behind time, so just one question. Anybody's got a question they want to ask? It might come out in the debate, but if, you know, what we'll do is we'll share the video afterwards, Matthew, and you know, if there's any more questions, any questions come up, then we'll, yeah, we can take questions at the end, but we can also, you know, pass on issues to you as well. But thanks ever so much for that, Matthew. That was excellent. So our next speaker is Professor Phil Taylor from Strathclyde University. He's been doing some fantastic work during the lockdown, doing some service with call centres in Scotland and the rest of the country, and also some really new work that he's doing on home working. So over to you, Phil. Need to unmute.
Yeah, thanks very much, Janet. Thanks for the invitation. That was great, Matthew. Thank you. I mean, a really, really sharp, focused, passionate insight into where we are now. And I've got two young ones myself, you know, and it's what you say resonates so much with them. So excellent. I'm going to start by just simply talking about what, as Janet mentioned, what I've been doing for the last number of months, briefly, because I want to get onto the situation today and to talk about working from home and some of the issues that have arisen from that. But since March and April, I've been working on contact centre workers, call centre workers and back office workers, and a bottom-up look at what they've experiencing and what we can do about it from COVID. And it started because myself and people in the unions, and of course Hazards as well, were receiving anecdotal stories from individual workers and groups of workers about the problems that they were currently facing. And of course, these were very, very acute, weren't they? These were the worries that COVID was causing huge problems in their workplaces. But beyond anecdote, what we needed to get was hard evidence, data that could push back against the employers, that could protect workers, get them home, and also to put pressure on government and try to improve the regulatory protection for workers as well. Okay, so I'm talking largely about office workers. Why is this important? And I'm going to return to a word that Matthew used, pre-existing, because I think this is really, really important. But the nature of the crisis that COVID brought to office workers has to be understood firstly, and I won't talk at length about this, but understanding what COVID is, or rather SARS-CoV-2 as a virus is, and how it can be transmitted. And people know, of course, that it's transmitted by large droplets that drop down, become dried, desiccated, and surfaces get contaminated, and people could get it this way. There was a general recognition also why we got the 2 metre rule, which the government has been trying to slice away at and reduce, because large droplets get transmitted and the airborne transmission route is important. But what was really misunderstood and has only recently been acknowledged more fully is that there is another transmission route, and that's small droplets, micro droplets that are airborne when people cough and sneeze, we know that, yes, but also when people talk loudly or converse or what have you. And more than this, there's been a far greater understanding of the recognition that droplets, both large and small, can remain suspended in the air for long periods of time, and indeed in indoor environments can be projected really quite long distances. Why does this matter? It matters because most offices are constructed around a particular way. Workers are clustered together in tight groupings, centralized offices, the big ones, the Bootle Inland Revenue Building, the big bank buildings, the back offices, the call centers, and so on, where people are clustered together in really quite small physical spaces, in pods, in rows, in banks, in U-shapes, whatever it is, where physical space is at a premium for capitalist cost-saving priorities. And then, of course, these offices tend to be open plan, right? Not discrete spaces, but also have within them heating and ventilation systems that have the capability of transmitting these airborne droplets throughout the building. Now, pre-existing, we know from previous research and a lot of studies that workers have complained for years, decades in fact, about the conditions that exist in offices. Classic, somebody comes in with a cold or a bug, everybody gets it. Now, if you inject into this environment a virus that is deadly, is highly infectious, then you end up with a toxic combination. As a worker said to me in one of the initial researches that I did, really what you've got in many offices is a petri dish of contamination. It's like, as another worker said to me, walking into Sniper's Alley. If the virus doesn't get you one day, it'll get you the next day. Now, of course, this leads to a whole series of physical problems, and the extent of illness in offices was enormous in this period of March and April, and the testimony I've got is really quite harrowing. What we were about at that stage, and hazards played a really important role in this as well, was quite simply getting people out of the workplaces and working from home, and should never return to the workplace until that workplace was deemed safe as they saw themselves. Now, this involved collective action by unions to make sure this happened in unionized workplaces. But of course, it carries something else with it. And this is the huge mental stresses, strains, and anxieties that come with working and living in this state of kind of essentially fear or terror of the fact that you're going into work and would be experiencing these things. And I'll come to this now, and I'm going to, in the short time I've got, draw upon, and you lucky people are getting the first findings from this working from home survey that Janet mentioned. And it's not difficult to see how mental health problems, now we're not, pre-existing, Matthew said, what we have in many offices, of course, has workplace regimes where performance management, micromanagement, intensification of work, greater job demands placed upon individuals have grown significantly in the last 15 years, 20 years, and have been accelerated by the impact of the economic crisis as managers and employers try to squeeze ever more work effort out of workers. So here you have this toxic environment when it comes to the virus, people's anxieties from this virus layered upon an experience at work that has been stressful for quite some time. The first question that we asked in the survey, or one of the first questions was there a delay between the date you wanted to go home and you were fearful for your situation and the date you actually did go home? So here you have an element More than one third, 37.8%, said, yeah, there was a delay. And then 60% additionally said that that caused that was a great deal of risk involved in that, or some risk. So you begin to get this picture of the physical threat, the hazard being blended in with increased sense of mental distress. The figures are there, aren't they? And this survey, which we've now got 1,600 responses to, asked people to think back about their experiences of when they transitioned to home working. So what was it like for people? 73% said they were worried about catching COVID in the workplace. 74% said that they were worried about giving it to their family or friends. 84% showing workers' genuine and general collectivity said that they were worried not just for themselves, but their workmates, their colleagues would also get contract COVID-19. And you think about it, workers travel to work. They travel, many of them, on public transport. Here's the figure, 65% said that they were, can you imagine, going into work every day on the train or the bus or whatever, knowing that you're going into a workplace that's going to possibly either end your life or make you very ill. 65% said they were worried about traveling to work with COVID. And then you go through the specific things that cause people great angst. And it's really interesting that heating and ventilation system, 70% saw this as very risky in the workplace, the highest single factor. The other one, hot desking. Every time you're sitting at your desk and you think, who's been using this before me? Was it cleaned properly? It's not just a physical hazard, it's also a mental hazard as well. The degree of social distancing, 70% said that this was really problematical when walking through the building. So every time you're walking through the building, you're carrying with you this sense of fear. Now, these are some of the basic things, the fact that team meetings and one-to-one meetings were still taking place and so on. I think what's also interesting about this survey is that we asked people whether or not, now folk are working from home, what about work demands when you're at home? And 31% said that work volumes were greater at home than in the office. 34% that work was more intense. That 30% the pace of work. So what you've got is, whilst positively workers are now working from a safer environment, the work demands don't just stop there. In fact, it looks from all of the evidence here, that's 1,600 responses, that the work demands have increased. And monitoring and control systems still exist. And of course, we can get into the causes of stress and deconstruct it. But this sense of lack of control is really important. And here's something I hadn't anticipated with the findings. 55% of respondents said that their employers were now using automated systems to monitor their activity through a device. Right? So the sense of control over the pace of work and how you're controlled and so on appears to be diminished when working from home. I have the same targets. Most people said, yep, we've got the same targets. The key performance indicators haven't changed. I may still get put on a performance improvement plan and so on. I might underperform against targets. And here one would think, if employers were generally being correct in their approach and should be modifying targets, only 20% said that the managers had modified the targets since they'd been working from home. Something else I think that's important as well, Matthew mentioned financial anxieties as well. We're about to move into the autumn, we're into the winter, a bleak winter it would appear, unfortunately. And money worries are emerging. And it's not as if people don't have money worries already. I mean, real wages for those in work have declined significantly over the last 15 years. But the cost worries, 2/3 of organisations say, of respondents say that organisations should pay for the broadband, yet 20% are saying they've had to buy their own equipment, that utility bills are rising, they have to pay for their ergonomic equipment. And then when we move to the health and safety direct issues, there is, of course, a litany of complaints. I'm not saying by everybody, but these are significant. 30% say that the desk is inappropriate for them. 37% say that they do not receive from their employer reminders about the display screen equipment regulations. So what I'm pointing to here, I suppose, is a whole series of ways in which unions and health and safety reps can take elementary steps to ensure that employers are meeting their responsibilities and their duties. I mean, for this meeting here today, I think the killer stat that I found is that 36% of respondents say that their employers do not encourage them to report mental ill health problems. That's really shocking, actually. It really is shocking. And there seems to be, amongst a significant minority of workers or their employers, a lack of recognition of what comes from the transition to home working and the pressures that it brings. Has there been an improvement in physical and mental health? Now, equal numbers say, 31%, that the physical health has worsened as has improved. Mental health, 34% say that the experience of working from home has worsened their mental health, although equal numbers say it has improved as well. So I think working from home is showing a contradictory picture. Harder work, more intense, monitored, physically being removed from a stressful and dangerous workplace is a good thing. But yet, I ask this question: if you want to return to the workplace, what are the reasons? And 80% who responded to this question said they miss the social interaction with their workmates, with their colleagues. The sense of isolation that comes is a problem. I miss the work interaction. People think that work and life should be separate spheres. The spillover of family demands into work and work into family clearly is an issue. The workstation is not appropriate, say 30%. But if you look at what people are saying from working from home, and I think this is important, what are the reasons why people might want to remain working from home? 87% say that the hassle of travel to work is something that's gone, and that's a good thing. The cost of traveling to work, working from home is safer. There's the possibility of more flexibility, and working from home is less stressful. There's a split decision on this, whether it's more or less stressful. I'll just finish on a couple of things. Just to remind ourselves, if we needed reminding, we asked the question whether or not individuals would be worried about returning to the workplace. Only 19% said that they were not, and 68% said yes, they were, either a great deal or to some extent. So it's well understood that with COVID or coronavirus still in the population at large, and their experience of having worked in these workplaces, that returning to workplaces remains a serious threat, both physically and in terms of the mental hazards that people face. And I'm just going to finish on one quote, if that's okay. I think I've been okay with my time, haven't I? And that is, I've got an enormous amount of testimony that I'm trying to work through here. I think working from home has the potential to be really good. But if the company does not engage with staff about changes and as inflexible in their approach and continually changes things without a clear or sound evidence base, then it doesn't matter if you're working from home or in the office. Staff will be fed up, demoralized, and stressed. Only difference is when that's the case and you're working from home, you have the additional issue of being unable to vent with your colleagues without fear of recorded conversations, and also of feeling invisible and unimportant to managers as you're out of sight and therefore it becomes harder to have those in the moment conversations regarding your concerns. I think that's a brilliant quote, which captures both the relief in the sense, good God, I'm not going into a workplace that could well kill me and all the pressures, but nevertheless, at the same time, acknowledges fully the difficulties and the challenges that working from home present to workers. And here we have two spheres, the work and the workplace, and the new workplace, which is the home, into which unions necessarily have to develop agendas that represent workers in both respects. This is a new frontier for us, and we have to ensure that all of the protections that unions intervene with workers and create new ways of working representing workers in the home as they would in the workplace.
Thank you so much, Phil. That was excellent, and really showed the I think the development in terms of work, about where we're going with work. I mean, there are some good things about working from home, isn't it? The flexibility for women, especially with caring responsibilities or people with caring responsibilities. There's all that sort of positive side to it, that you've suddenly found that we're able to work from home and do our work at the same time. But there's certainly some downsides to that as well, and as you've explained. And our employers have still got a duty of care, whether we're working in a workplace or working at home, for our mental and physical health. And when I'm thinking about the list that Rob read out, in terms of the stress management, and the management standards, the controls, the demands, etc. What we need is employers to take that seriously, both inside work and when we're working from home, and to forget about this over-the-top surveillance and control that they seem to want. So I'm going to just open it up to anybody who wants to ask a question. John, did you want to ask a question? Hey, John.
Yeah, hello. Phil, what a fantastic presentation, very informative. I'm very much familiar in many a workplace. But before I go into what I want to say, I think I need to explain. I certainly owe an apology to this committee. My late arrival into the meeting, I just got the back end of Rob Miguel's presentation, and so I only missed part of Rob's. I make no excuses. I'd actually dropped it into the calendar on my phone for tomorrow. I was all set up for tomorrow for this meeting, believe it or not. So getting a bit of a heads up off Becky while I was in a previous meeting, forgive me. My bag, my fault, so I do apologise, but it's wonderful to join anyhow. So, Phil, absolutely, totally understand everything that was said, centred around probably predominantly clerical workers within cross-sector, within all industries, as we have clerical workers in the place of where I work. I do represent transport and mobile workers. However, given the subject that you've strongly put across, I'd like to put a different steer on it, although everything you've said is undebated. There is comfort of certain people under the climate that we're all living in with COVID-19. The comfort is there of not having to leave your house and being set up workstations at home and given that security, peace of mind, and family environments to see that your own is being looked after while you're working from home. However, when you look at the issues that come off the back of working from home, is a lot of companies are seeing suit for clear out, synergies, and job cuts.
Right.
So when you, and by the way, this is not a criticism, it's just a different steer.
No, I get it.
So you're finding a lot of people feeling comfortable and then very quickly bringing on anxiety and mental health issues in relation to threats of job cuts. Right. What are your thoughts on that, Phil?
Well, I mean, absolutely, if I can answer that one now. I mean, literally these questionnaires have been tumbling in, and this is my first this really is my first run through this evidence. And what you're saying, if I'd had longer today, John, I would have said a fair bit about this. And I've got some hard evidence on this that will come out the next time I do this. And it's clear from what people are saying, and it's basically round about the 25-30% mark of people who are saying this. They're worried about the job reorganisation. They're worried about the content of the job. They're worried about a job insecurity as a result of this. They're worried about, you said, that it's kind of the leaning stuff that might take place. Some are worried, a lesser number are worried about automation and what that might bring. And I think we're in a phase, John, where we've been through it. This is the initial shock. Oh shit, the relief, we're home. God, we're safe. And now what you've got, because if you like, the frontier of control has changed. Employers are now looking at ways in which they can squeeze the effort, restructure jobs, maybe get rid of folk, and so on. And that's been reflected in what people are saying to us. And it'll be really interesting if we did this. I mean, we have to stop it, obviously, but it's clear, I think, from the evidence that a minority of people are beginning to show real concerns for their jobs. And it depends, doesn't it? A lot of it's about the product market and where they're working, because there'll be some areas of work where volume demand is going down. There'll be others where volume's going up. It's an uneven picture, but there is no doubt there's redundancy concerns, there's employment security concerns, there's intensification of work concerns, and you can see that. I mean, look at the figures in terms of the volume of work. People are working harder at home. It's a misconception to think that this is cushy in any ways. I mean, I also found, and there's another one here, the stuff will come out, that very large number are saying that they are doing extra unpaid hours at home if they cannot do the work within the allotted work time. Very frequently, most people, I think it's about 40% actually, were saying that they will do work outside their allotted work hours and so on. So I think the picture of Peyton, John, is an accurate one for a good minority. It's certainly true of a good minority of respondents. And hey, we know what employers do. They'll take advantage of a situation if they can get away with it.
Thanks, Phil. John, do you want to take over chairing?
Absolutely not. You don't turn up late and take over the show. Can I just say a massive thank you to yourself, Hilda, Becky, and obviously Karen Devine. As chair of this wonderful committee, I think it's fantastic, and it's great to have the power and the people who can make things happen. And this meeting is vitally important. Do I need to be a chair of this meeting today? Absolutely not. You're the chair, and the subject is the chair of this meeting. So let it crack on.
I'm going to bring you in at the end then to do some closing statements.
All right, thank you.
Thank you so much for that, Phil. I'm sorry we haven't got more time to talk to you about the issues. And it'd be lovely to have you back.
Yeah, I make one appeal just finishing? If I post the link to the survey, if we could get it out as wide as possible around the wonderful part of the world, the Northwest, that I know so well, that would be great. Thank
you so much, Phil. Right, I'm going to bring in Janet Farrar now, who is a tutor, a lecturer at Manchester College on trading education. She's also the president-elect of UCU, and that's what she's doing at the same time as she's doing this. So lovely to see you, Janet. And sorry, we're running a little tiny bit late, but hopefully, do you want me to share your slides?
Yeah, if you don't mind, Janet, that'd be brilliant. Thank you. While that's happening, I'll say hi, everyone. I'm really sorry that I couldn't be here earlier and that I can't be here later. I'm currently caught in some kind of circle of hell that we're calling interim online congress. So I'd much rather stay here, believe me. So just to introduce myself briefly, Janet's done a brilliant job anyway. I work at the Manchester College. I teach in trade union education, and the other half of my time I'm seconded to UCU. And at the Manchester College we do, we do a whole range of courses for the TUC and for affiliate unions. But for my purposes today, I also teach mental health awareness to reps and to members, and also mental health first aid, which I know there are some kind of mixed opinions on, but I'm happy to stay for a few minutes and chat about that if anyone wants to. So thank you very much for the invite to Unite the Union and to Janet and to Hilda, the wonderful work that the Hazard Centre do. So they've asked me to talk about supporting workplace reps and, read their health and safety reps as well, in terms of supporting members really with mental health issues. And, I think just as a way of introduction, we do, as workplace reps, we do have a lot expected of us. We do wear a lot of different hats, metaphorically speaking. Sometimes you can feel like a barrister, sometimes you can feel like a social worker, sometimes you feel like a counsellor. And we do often in that forget to actually look after ourselves. And, we're just so busy looking after our members, essentially, through casework and otherwise. So this presentation is supposed to remind everyone of what actually is the rep's role in supporting members who experience mental health problems. We are not mental health professionals. I mean, some of you might be, but I don't think so. I'm certainly not. And we still need to set boundaries for our members and manage their expectations in order to protect ourselves. Because frankly, you're no use to anyone if you burn out as well. So thanks for the next slide, Janet, which, as you can see, I'm starting with a recommendation for the TUC guide, mental health in the workplace. Remember real life where we had things in hard copy and we could, hold it in our hands? Well, I don't know whether or not the TUC have got any hard copies left of this, but it's available as a free PDF, and it is absolutely excellent. I would highly recommend it, and that is where some of the information in this presentation has come from. If you could have the next slide, thanks, Janet. So just as a bit of context, really, I apologies because I don't know exactly what you've been talking about already. I know you've had a presentation on stress, but really, when we're talking about mental health problems, we're usually referring to depression and anxiety, which are obviously the most common. But there might be members of yours who are dealing with a whole range of different disorders, quite a lot of which people often don't even realise come under the mental health umbrella. So I've just included a few there. I'll just pick out obsessive compulsive disorder, which is quite often kind of ridiculed and sidelined in the workplace. If someone, doesn't have their ruler perpendicular and they say, I've got a bit of OCD, then that does devalue what is a very, very serious and debilitating mental health condition. Eating disorders, something that we don't talk a lot about, and there might be members of yours who are experiencing eating disorders that can have a huge impact on the way they are in the workplace. So I won't read them all out, but you can see that there are also severe mental health problems on there, which would require medication. So if one of your members does declare that they have a mental health condition to you, whether or not it's one of those on the list or something separate, firstly, job number one, you need to get them to go to their GP. And it sounds like a really obvious thing to say, but that is the most important thing. And that's, sometimes you just need someone to say that to you, actually, to want to do it. And there's lots of things I could say about that, but I need to try and keep short. But all I would say is people that are phoning their GP, especially men, I have to say, for the first time, about this kind of thing, it's really important that they ask for a doctor who has a specialism in mental health, and there will usually be one per surgery, and that will stop what it does sometimes happen, which is people being faced by a doctor who doesn't think that mental health is real. And the mental health problems are real, so that can be incredibly damaging. So that's just as a side issue. But if one of your members does have a mental health problem and they do tell you about it, as well as signposting them to professional help, which is the single most important thing, there is absolutely no harm in just doing a bit of background reading yourself, just, you know, educate yourself a little bit about these incredibly complex conditions. And the internet, as we know, is a bit of a minefield. So if I could have the next slide, Janet, I would highly recommend this website. It's written in layperson's terms. It's you can put in any mental health condition into a search engine of your choice, one that pays taxes or one that doesn't, and you just put whatever the mental health condition is plus the word rethink, and you will find that they have a worksheet for every single certainly the main mental health conditions, and it just gives you some really good, clear background information about symptoms, you know, help that's available, that kind of thing. And it'll just might make you, you know, knowledge is power, isn't it? So it might make you feel a little bit better about you know, speaking to that member, because things like psychosis, people are real scared of. You know, people are still kind of stuck in the Daily Mail-esque, you know, crazy, you know, people with knives wandering the streets ready, you know. I mean, that is not what psychosis is about, you know, and it's just about kind of demystifying that kind of thing. So don't you know, don't allow the internet to bamboozle you with this stuff. You know, just kind of focus in on anything that you need to focus in on, and that's a good place to start. Thanks, Janet. So it feels like I'm thanking myself, which is a little bit weird. But so I'm pretty sure most of the people, or all of you in this room, will already know this already. So I'm not gonna dwell on this, and I don't know what's been said during your session already today. But you know where you stand in terms of legislation, and as you will probably already know, there are two sides to legislation that protects people with mental health problems. The first is the Equality Act, and the second is the Health and Safety at Work Act and other health and safety legislation. So under the Equality Act, you cannot discriminate against somebody because of their disability. And if I could have the next slide, please, Janet, that describes the disability in the Equality Act is described as having a mental or physical impairment, and you know, it's the mental bit that people often forget, that is substantial and has a long-term adverse impact on a person's ability to carry out normal day-to-day activities. Now that is further up for discussion, because obviously this is a legal definition, not a medical definition. So it's massively open to interpretation, but you will find that most people with mental health conditions, you know, there is an argument for them to have reasonable adjustments in the workplace, and certainly for them not to be discriminated against because of that condition. You don't have to have a formal medical diagnosis to come under the legal definition, and you know, impairment can also include any of the side effects, essentially, of mental health conditions. So put the example there, if you're very tired due to antidepressants, then that might need to be the focus of your reasonable adjustment rather than the symptoms of your condition itself. Next slide, please. So on reasonable adjustments, I feel like I'm covering a massive area in a very short amount of time, so I do apologise for that, but I think we're quite well versed in dealing with reasonable adjustments, but they are usually for physical disabilities, and I think quite often reps don't know as much where to start in terms of reasonable adjustments for mental health. So there are some examples there of things that could be. The issue, of course, is that you know, it's very, very difficult to pin down what reasonable adjustments might be needed for different mental health conditions. And as we know, one person with depression is not going to need the same things in the workplace as somebody else with depression, because it's an incredibly complex and wide-ranging condition. So these are just examples, and it's really important to re-emphasize that actually this is very much an occasion, as with any other disability, but even more so that the member is directly involved in these conversations, that nobody is taking that decision away from the member. They are the best placed person to tell their union rep and their employer what will make their life better in work in terms of their mental health condition. So, you know, changing the location of work or allowing to work from home, I just caught the tail end of Phil's excellent presentation there. You know, some people it doesn't suit them to work from home, and equally, you know, but people might be working on site and feeling very anxious at the minute, which might be exacerbating pre-existing mental health conditions or creating new ones. Other things that might be considered reasonable adjustments: extra time off, really common and sometimes needs to be said plainly to the employer. They might need appointments, yeah, and that's in the employer's interest to make sure that people have time for that. And you know, some kind of flexible working. Most employers offer some kind of employee assistance program, or maybe access to limited counselling. So just making sure that that is evident in policy. Next slide, please. So loads of things that, you know, cover the role of the union rep, and you will notice that none of them involve being a mental health professional. We can promote good mental health and well-being and raise awareness of issues. But if I can just hone in on what for me is the most important thing on this slide, and I'm happy to share the slides, of course, through Janet, is about tackling and challenging stigma. Now, unfortunately, I don't think this happens enough in workplaces, and I think that every single worker has a responsibility. Managers, non-managers, lowest rung to the highest rung, every single worker needs to challenge stigma around mental health when it rears its ugly head. And you know, if somebody is off long term and there's a presumption that that is, you know, depression or some other mental health issue, and people are not taking that seriously because it's invisible, that needs challenging, and that can be sometimes the toughest thing to do, but the most important thing to do. And I think as reps, definitely we have a responsibility to be saying, you know, you don't know anything about that person's situation, so please don't make any presumptions. And certainly you wouldn't want somebody to do the same about you if you were on long-term sick for any other reason. And of course, really important, workplace policies. We know still that 80% of workplaces still don't have a specific mental health policy. It's usually covered within sickness and absence, you know, bullying and harassment, other policies. But having a specific one for mental health, I think, is a really strong statement. And let's be honest, you know, employers love a badge of honour, don't they? And if it makes them feel good about themselves, having negotiated a workplace policy, it's a good place to start. Next slide, please. This just shows a document that is a really good place to start if you don't have a pre-existing workplace mental health policy. TUC have produced this really simple document, which is just somewhere to start with your negotiations. And I think it might be that mental health first aiders become part of that policy, but that does depend certainly about raising awareness, certainly including clauses where people are like crystal clear about what their roles and responsibilities are. And if anyone is interested in mental health first aid, I'm not here to promote that, but if you are interested, you can get in touch with me or with Mike at the Manchester College, and we can talk to you further about that. So just in summary then, I've covered quite a lot of the kind of practical, well, whistle-stop tour through the practical aspects. Just a few things in summary. The number one job is for you to protect yourselves, or if you are a union employee, for your reps to protect themselves, and not to get too emotionally invested in casework, which, you know, is easier said than done, depending on what it is. Do not give out your personal mobile number. Do not give out your personal email address. If you have done, ask members to use a different one. Set up one just for your union business. You can get a pay-as-you-go phone for hardly anything. You know, it won't help anyone if you say things like phone me anytime, you know, because for somebody with a serious mental health complaint, that, you know, could mean phoning you at 3 o'clock in the morning. You don't want that. You can't do that. It's not possible, and it doesn't maintain the professional boundaries that we must maintain. We know that the NHS is on its knees at the minute, so whereas you should be signposting people to their GP, and you must do that, and there are other things available. I've mentioned Hub of Hope, which is an app and a website whereby you can put in your postcode or your member's postcode, and it tells you about the support services that are available in their area, and you can even filter by mental health conditions. So that's a really helpful resource in these times. And, you know, as well as signposting our members to the employee assistance programs that exist, we need to be making use of those sometimes ourselves. You know, so if you need to look after your own mental health, that's my timer, and you need to be taking some time out. And, you know, if you've been dealing with a member who is suicidal, then you use that employee assistance program yourself. You know, it's really, really important. We don't always think about that ourselves. And just finally, one of the most useful outlets for me as a workplace rep was having the opportunity to offload onto another workplace rep. And it was so important that, because the stuff that I was dealing with was confidential within the union and within the branch. So I used to spend half an hour once a week. It was completely immovable, where I would sit down, and a bit like counsellors do with supervision, I would offload in terms of the casework that I was dealing with, the difficult negotiations, maybe horrible emails I'd had from the employer, that kind of thing. And I would just get it out of my system in a safe space with another rep. And of course, I was willing to then return that favour. And I don't think we're making enough time for that, but it's incredibly important that we do, in order that we protect ourselves. So the final slide is just some resources. I hope they're useful to you. I'm sure some of them will already be very, you will know about them already. I'll just highlight mentalhealth.org is the Mental Health Foundation website, which is excellent, and it has things like podcasts for improving sleep and things like that. And Zero Suicide Alliance, which again, I know that that suicide is on the agenda as a topic today, and there's some excellent free online training for suicide awareness, which, all I would say is, as well as the half an hour that it takes to do the training, just make sure that you're feeling mentally well yourself before you embark upon that. But it really is excellent. Okay, I'll leave it there. Thanks, Janet.
Thank you so much, Janet. That was really interesting. It's brought up a lot of issues, I think, that we've been talking about over previous months. I sort of smiled when you talked about trying to get hold of a GP at the moment. And I think, it's a time when we need mental health support more. It's really difficult, isn't it, at the moment, to get hold of GPs in the first instance, but then to get them to support us is another difficult issue. And I think Matthew sort of talked about that earlier. And it's certainly something that we need to be aware of, and how much more support we're going to need in our workplaces now. I know we're a bit behind time, so I'm going to just move straight on. But thanks so much for joining us, Janet, and giving us that presentation. And we'll obviously have some questions and issues that perhaps we'll come back to out of this meeting. But our next speaker's here, and I'm really pleased to introduce Sarah Waters to you, who's somebody we had speaking at a hazards conference, and has done some fantastic work about workplace and suicides, and I think really enlightening work that we need to act on, and to look at how we can take this forward. So over to you, Sarah.
Okay, thank you very much, Janet. I hope, can you hear me okay? Yeah,
yes,
okay. Excellent. Yeah, thanks very much for the invitation. I caught the very end of Phil Taylor's talk, where he was talking about work intensification, which is a key sort of issue in my research as well. And also Janet's talk was so interesting, looking at workplace mental health. I've been very interested in looking at mental health from a social and structural perspective, looking at how the workplace can generate mental health problems which mightn't have been there before, and how the workplace can have, in some cases, a very damaging effect on mental health. So as you mentioned, Janet, my research has focused on work-related suicide in France. I studied 66 cases of suicide across 3 large French corporations. And my aim was to look at the causal connections, the causal links that connect the, extreme, desperate individual act of suicide and their experiences of work, the structural conditions of work which have brought them there. So how can work drive someone to take their own life, and what do work-related suicides tell us about today's globalized workplaces? Because this is a new phenomenon in historical terms. I looked very specifically at at suicide letters, at the notes, at the emails, at the documents, at the audio recordings that suicidal workers left behind, in which they try to explain or communicate the motives which led them to such a desperate act. So while my research is focused on France, with colleagues in Hazards, with Rory O'Neill, with Hilda Palmer, we've very much tried to use the French context as a way of shining a spotlight on the UK context, where there is very much a failure to recognize, to monitor, to regulate work-related suicides. And we have worked very much to try to put pressure on the health and safety executive to show them the dangers of not regulating and recognizing work-related suicide, and trying to push it to change its stance on this question. So just briefly, my research focused on 3 large French corporations. One was recently in the news, France Telecom. In December 2019, 4 of its executives were handed criminal sentences for their role in pushing up to 35 of their employees to suicide as a result of their management tactics. The boss of the company, Didier Lombard, was handed a 12-month prison sentence. And so this was really a landmark case. The background to this story is that the company had a restructuring plan which involved cutting 22,000 jobs across the company in the space of 2 years. The company had recently privatized. They wanted to cut costs, and so they were desperate to try to reduce salary costs. They faced a problem, however. The vast majority of employees at the company were public service employees. It was very difficult to make them redundant by formal legal means. They had protected status. And so what happened at the company was that management resorted to these sort of quite nasty, insidious psychological tactics to try to get them to leave the company of their own accord. And these tactics were actually they were instructed, managers were instructed in using psychological tactics to pressurize employees, so their lives would be so miserable that they would want to leave. So things like management bullying, colleagues or employees were moved at a day's notice from one city to the next, 300 miles away. They'd have to leave their families. Their jobs would be changed. They'd have to change jobs every 4 months. There was a cluster of suicides amongst engineers and technicians who were highly qualified and who were demoted to work in call centers. So these were white-collar workers in their 50s, going from very professional, very autonomous roles to being forced, if they wanted to keep their job, to work in a call center where they had to, recite a script over the phone, where they had to ask permission to use the toilet. And you had some of them who cracked up. So there was a cluster of suicides in call centers, which is, I suppose, an example of a wider problem across the company. I also looked at the car manufacturer Renault. Phil Taylor talked about work intensification. This was central to the cluster of suicides that took place at Renault. I would say also, in case I forget, that really important to emphasize that in all of the companies where suicides took place, they were not random individual events. They took place at a specific moment in time. They took place when each of the companies was restructuring and when there was a very profound change in working conditions. The suicides coincided with the implementation of a restructuring plan in each of the companies. At Renault, the restructuring plan was meant to massively increase production. The company was required to increase sales by 800,000 units, and they were to produce 40 new models of car in the space of 3 years. I looked at suicides that took place in the company's research center, where you had engineers, technicians, designers who were involved in designing and conceptualizing new cars, and they were placed under unbearable pressure. You know, all of a sudden they were told that their targets had been set at this very, very high level. These were targets that were impossible to meet. And there was a cluster of 7 suicides in this research center outside Paris, where you had these employees who experienced a period of chronic overwork. They began to work obsessively. They began to get up in the middle of the night to work on their computers. There was a breakdown in their normal patterns of communication, in their normal routines. And these were typically very dedicated workers. They were what's known as corporate warriors. They measured themselves against their job. And when they were faced with these impossible targets, it generated this sort of catastrophic breakdown. Similar, I would say, to in Japan, you have the phenomenon of karajitsatsu, of suicide as a result of chronic overwork and impossible targets. And in the research center, the suicides all followed a very similar pattern where they took place in the workplace. They jumped from an internal walkway, and it was a very public and traumatizing experience for everyone involved. I work with the lawyer who Renault was taken to court and got cases. Three of the cases led to rulings of gross negligence against the company. This is really important. In France, a lot of the suicides have led to successful legal cases against the companies, where they have had to modify and change their practices, and other companies have had to take note. And I worked closely with one of the lawyers, and I had access to her legal file, and was able to look closely at the letters that were written by the employees in those cases. Another company
Sarah, you're frozen. Don't know whether that's a shame, isn't it? Just see if she comes back. Wait me a second. Sometimes what happens is people drop out and then have to rejoin. So we'll just see if she rejoins. I think it's worth saying, just while we're waiting for her to come back, is that, on the back of what Sarah's been talking about, we've been trying to mount a sort of campaign against the HSE to try and get them to take up workplace suicides, to investigate all suicides connected with the workplace. So where people die in their workplace, they die in uniforms, they die with notes or anything connected like they do in France, that we want the HSC to investigate those deaths as though they're workplace deaths. And I think we've talked before about some of the consequences and how people have died as a result of bullying and all sorts of other things in the workplace. And we can probably relate to all the issues that Sarah mentioned in terms of the workload issue and the way that people are treated in workplaces. I think I've spoken before and said, that the number of workplaces now that are, before the lockdown, before the pandemic, that were treating people abysmally, I can't say the word, abysmally, in the workplace, that they, not only having to put your hand up to go to the toilet, but they're timing people when they're going to the toilet. And at the end of the session, that they are sacking people at the end of weeks because they've gone over the numbers of minutes that they can take going to the toilet. So that's sort of unsurmountable pressure that people are put under, which leads to things like leads to suicides and people being treated totally. I've not think she's come back, has she?
Janet?
Yes, John.
I know we're using the time wisely while we're trying to wait for Sarah to return. But can I just make a very quick suggestion in relation to the previous speaker, Janet?
Yeah.
Yeah. Okay. Thanks. Just very quickly. I was on the regional committee Zoom call last week, and there was a powerful input by Mary and Tony Woodhouse on this very important subject. And obviously, when you look at this subject, it's right across all workplaces, and in trade union terms, it's cross-sector. Given the subject, it's about human beings, and I honestly believe the likes of Janet, the last
Farrar.
speaker, Karen, sorry, the last speaker,
Janet Farrar.
Janet. All right, Janet Farrar. Thanks for that. I believe she should be given a platform across all NISCs, across all sectors, to do a presentation and to raise this subject, because when you look at that very important PowerPoint and very pointed PowerPoint, you've the likes of subjects like postnatal depression, bipolar, and like one I'll throw in, undiagnosed autism in adults, which creates so many challenges and difficulties in their daily routines, especially under the climate we're living in now. But to my own sector, alcohol, it's a massive issue, and it can be very secretive, and it can be led from mental health issues. I really do believe we should use that last PowerPoint as a plinth throughout all our NISCs and risks. She should be doing the rounds on that. What you feel on that?
Okay. Any other comments on that? I think that would be an excellent idea that we invite her back, certainly to the next meeting, and then we can perhaps take it from there, John. I think that would be a really useful use of her presentation and her skills. I've got, she's not rejoined us, I'm afraid, so I don't know if anybody wants to make any comments about suicides in the workplaces. I know there's been a number of you on the call that have experienced suicides in workplaces, but sort of taken up the issue that she's raised in terms of, how effective having proper scrutiny of people's situation, mental health situation at work is, and it's certainly put in focus in terms of France, in how they treat people, so proper decent working conditions, but decent way of treating people. So I don't know whether there's anybody else wants to add anything. Oh, there she is. We've got Sarah back. Sarah, we just did a bit of ad-libbing in between. Need to unmute, Sarah.
Yeah, I'm very sorry. My internet has been a disaster all day, and I guess I predicted it would happen. Would it be better just to have questions at this stage, or what would you prefer, Janet?
Yeah, I think that'd be good. Has anybody got any questions to Sarah direct? Yes, Sue Bennett, is it? And Tony Woodhouse. Sue Bennett first. No?
Yes. My question is, how many people have actually committed suicide because of a particular manager? Not the management system, but a particular system of management.
Thank you, Susan. I'm not sure she'll be able to answer that, but we'll pass it over to Sarah in a minute. Tony, did you have a question? Hang on, you're on mute, Tone.
I do unmute myself. Am I okay now?
Yes, yeah, I can hear you.
Right. Obviously, I'm glad I didn't get in here till late, by the way, because I had another Zoom meeting, so I didn't get into after 3 o'clock. But I think we all know how big and massive mental health issues are going to be, especially now with the COVID. It's going to make it even worse. Well, I think we all know, by the way, most mental health issues come from the community sometimes, or the position you find yourself in life. But what really struck me a little bit there in that report was obviously Renault, the car manufacturer, and going to court with so many suicides to try and find out what impact, if any, did the trade union have involved in it? Because we're always told trade unions in France have got a lot more power and a lot more things than we have. And, Renault's now just took over Vauxhalls in Britain. And obviously we find out people in Vauxhalls and there'll be a poor going through so many changes with the threat of shutting the factory down if you don't. But I'm just interested to find out what part or no part did the trade unions play in the part of trying to defend our members, or if you played any part in it. Because it's really, to talk to someone like me as a trade unionist, talking to French people all the time, it really hits me. It hit me. I knew it was bad, but if it's getting that bad where it's happening in places where we know we've got trade union recognition and it's supposed to have strong trade unions, then it's a big worry, but it's a lot bigger worry than I thought it was. So I wouldn't mind if there's any impact back on that, about what part of trade union part and what part did they play, what you should have done.
Okay, thanks, Tone. Kevin, do you want to just ask a question as well?
Yeah, please, Janet. I know you mentioned before about, I suppose this is a point for you, really, and for Unite in general. I know you mentioned before about you're trying to appeal to the HSE, or you're trying to pressure the HSE to start workplace investigations. It's my sort of feeling, I've got no evidence of this, that the HSE are useless now. Can't we try to use Unite's political wing to get some tighter legislation in place so that, when there is a workplace suicide, you've got to carry out an investigation under law?
Yeah. Okay, Sarah, back to you.
Thanks very much. They were great questions. In relation to the first question, I don't have specific figures as to how many suicides were directly linked to bullying by a management. What we do know is that in France Telecom, it was linked directly to systemic management bullying, that bullying was used as a managerial technique to achieve economic goals, to reduce staff costs. So this was very much an institutionalized form of bullying, which was the basis of the legal case, the criminal case that was taken against the company. Absolutely. Trade unions have been absolutely crucial in France in initiating the cases that have resulted in court proceedings. It generally was the trade union that started the ball rolling. And in France, you have a number of lawyers who are very happy to work closely with union leaders and who have taken up the baton. But really, without trade unions, these cases would never have come to light and would never have been made visible. In the big France Telecom case, it was really started by SUD, the trade union organization, taking a case against the company before the courts. So really, they are the start of everything. They are what has got these cases going. In relation to the HSE question, Absolutely. I mean, I think what the difficulty is it's a case of hear no evil, see no evil, because cases aren't recognized as being work related. It's very easy to say that they don't exist, that this person had, mental health issues, they had personal problems, and that was what the cause of the suicide was. Because suicides aren't recognized, HSE just dismisses them as being not work related. Their line is that suicides are individual, they're a mental health problem, and that is not, it's not up to us to regulate in that area. And we have said very strongly, look, in France, in Japan, in the United States, they're not considered to be an individual mental health problem. They're considered to be an urgent public health and workplace safety concern. And why in the UK would they be individual mental health problems when they're not elsewhere? So we've tried to confront them with their own sort of logic. But yeah, Rory O'Neill has been brilliant. He had a postcard campaign. I was involved in a petition movement where we wrote to the HSE. We got a response from them, but I have to say, and they said that they were prepared to change things. But COVID-19, unfortunately, has swept everything else to one side, and it's difficult at the moment to get any traction on anything that isn't COVID related.
And even if it is COVID related, it's difficult to get any traction, I think, as Kevin was pointing out, in getting the HSE to do anything at the moment. But thank you so much for that presentation, Sarah. It was really interesting. And I think, we need to think about how we put more pressure, lots of things that Kevin's raised, how do we put more pressure on the HSE? How do we put more pressure on government to change legislation to support? I mean, we want them to be investigated as workplace deaths. We want people to be held account when people die in the workplace as a result of workplace systems, whether it's bullying, whether it's individuals, whether it's just the way that people are being treated. And I think more than ever, we will see a massive pressure being put on people, and we need to respond to that. I mean, before the lockdown, as you indicated, the HSE were talking about starting to investigate stress-related issues, which would have helped, sort of lead us forward, I think, in terms of getting the investigations. But that all went on hold, as you quite rightly pointed out. But it's certainly something we need to continue. So thank you so much for that, Sarah. And really, it was really interesting, really informative, and I think has given us a lot of food for thought.
Thank you very much.
Now our next speaker is Jim Mowat. Unfortunately, he's not joined us, I don't think. I don't know whether anybody knows. Must have been called away for something important if he's not attending, because he looked like he was really interested in turning up to the call and speaking to you about Unite education. I don't know whether anybody else is able to do that, cover that. Tony, it's over. Tony, I'm looking at you.
All I could tell you, by the way, on it is that we've been doing courses on it for, I don't know, just over 2-3 years now. Probably the most popular courses, I can only talk about the Northwest, they're the most popular courses in the Northwest. But once again, it just tells you about the merits, how to look for mental health issues, how to see someone who's got mental health issues, how to deal with someone. Our massive problem is that how do we deal with it in society? Now, my other worry is, by the way, this is going to be very, very, by the time this is over where we are now, it's going to be like, so we thought it was going to be bad beforehand. And my mind is boggled at how we're going to deal with it. It's going to be a massive, massive issue. And someone just talked there before about the health and safety. I'll tell you the problem with the health and safety, it's undermanned and underfunded. Like every other organisation. I remember back in the 1980s when there was 12 people looking after Merseyside. 3 years ago, there was 1.5 people looking after Cheshire and Merseyside. So we're putting the courses on. We're having shop stewards meetings and all that, shop stewards courses and other courses, company courses about the merits of mental health issues, how to see mental health issues, how to identify them. Maybe how to deal with the individual person, make sure you gain his trust or her trust. How someone you trustworthy you can speak to, have someone you can talk to 24 hours a day. claim the trust. But the big, massive problem is, how do you solve the issue? And that's got to be unions, companies, governments, and that's where you get your problem. You know, you find someone who didn't find themselves out of work. You know, I was talking at a meeting the other day, and I just mentioned to say about, can you imagine if people left school after a good education, got themselves a good, decent job, earned enough money to buy a house, have a car, have a holiday each year? How much mental health issues do you think we would have if that was the case? A lot few we've got now, and that's where we've got to tackle the problem in society. And the first thing, no disrespect, without making it political, is getting rid of this government. So I can only say we've got the courses on, we're doing the courses, but that's only a very, very small part. What we need to do overall to get anywhere near sorting this problem out.
Thank you for that, Tony. That was really helpful.
Jim would give you a lot more comprehensive answer than that, I'll be asking. Yeah.
Thank you. I'm going to give John the platform in a second, just to say thank you so much for all the speakers, and I hope that you found the different aspects of mental health that we've covered this afternoon helpful to you. But over to you, John.
Yeah, thanks for that, Janet. And obviously, thanks, Tony. But I want to look towards complementing what Tony Woodhouse has just said, based on a lot of information and my own experience. And I think standards of demand that we should be looking for. And I think a lot of workplaces and a lot of sectors have not really concentrated on this very, very valid subject and most important subject within any workplace. And believe it or not, given the experience and the direction that we've gone in our own workplace, you can make a very difficult job extremely easy in relation to making sure we're fully aware of who's responsible, because I'm hearing so many reps, and God love them, feeling personally responsible for making something happen which can be virtually impossible as a trade union rep, regardless of how many years in you've had as a rep. We need to make sure that we get the signposts pointed towards duty of care and the businesses we work for. Even if the mental health subject is personal and from home, because if people, it's a common trait, people bring their personal problems into work and take their work problems home. So therefore, there's out and out attachment to work. And I can tell you now, any good organised workplace and any good respectable company should and most likely have the ability to assist under mental health awareness. And it comes under welfare. And everyone should recognise welfare in the workplace. So therefore, if you've got welfare in the workplace, you should have mental health awareness. A lot of companies have their own independent company that they go to, like ours is called, what's it called? Validium. It's called Validium. And we need to make sure we point our members in the direction of Validium to assist them. A lot of our reps get anxiety and end up in a mental health issue themselves because of expectation. And I know our union are doing very good work in the background. They're almost on the finish line on making a facility available for reps. I do support that, but I do believe if we get all the other stuff in place, reps may not need that facility, because what takes reps into a really low place is not having the ability to deal with someone's issues. So I think the foundations of this subject needs raising off the ground in order for us to make sure our reps have the tools in the box to address all issues. And let's not forget, and I'll shout it as loud as I can, this is about the business. This is about the companies. It's their duty of care. We should be screaming at the companies, sort it out and stop causing these problems for our workers. I could go on all day. Thank you.
Thank you so much, John. Right, and that brings us to the end of the session. So thanks very much for participation. I'm sorry it was so much that we had to get through and we didn't have a lot of time for a discussion, but hopefully to our next meeting that some of you will join us and that we will be able to take some of these issues and look at how we can campaign further on them. So thanks very much and have a safe day and safe year. Thank you.
Thank you, Janet. Thank you, Hazards. Fantastic.